When you're pregnant, simple day-to-day tasks such as getting in and out of a car or picking up your children can place unnecessary load through the abdominal wall, causing it to separate more than it needs to. While abdominal separation is completely normal and experienced by 100% of women after 35 weeks gestation, it does increase your risk of prolapse or urinary incontinence post-pregnancy. In this video, I'm going to show you modifications you can make to your day-to-day movements that will help reduce the load going through your abdominal wall and reduce your risk of prolapse and urinary incontinence after birth. Let's start with how you get in and out of bed. So before 20 weeks gestation, you'll be able to get into and out of bed with ease. You will basically swing your leg over, perform a crunch to get onto the edge of the bed. But after 20 weeks, the growing uterus starts to load up the abdominal wall and it makes it very hard to perform an ab crunch. So to avoid putting this strain on your abdominal wall, you want to learn how to do the log roll. So basically what you do is you bend both knees together, glue them together as you roll onto your side, and then as your feet come off the bed, you gently push up with your arm. This takes out the need to do an abdominal crunch, and therefore you are not loading your abdominal wall. So getting back into bed is just the reverse of this movement. So keeping your knees glued together, as you drop down onto your side, your legs swing up, and then keeping them again glued together, you roll onto your back and get into a comfy position. After 20 weeks gestation, it is also recommended that you no longer sleep on your back. So in this case, sleeping on your side is the best position. To do this, you place a pillow between your knees and under your belly. Basically, what it does is it keeps your pelvis and your spine in a neutral position, as well as supporting the weight of the baby so it doesn't pull unevenly on the abdominal wall. Another everyday movement that can place additional pressure on your abdominal wall is getting in and out of a car. So again, up until 20 weeks gestation, typically what we do is we swing a leg out of the car and then pull on the steering wheel to stand up nice and tall. When you do this, it is putting an uneven load through the pelvis, which takes the stability away from the spine. And basically, you don't have any room to actually lean forward because the steering wheel will be in your way as your belly grows. So the first thing you need to change is actually making sure that you place both feet out of the car onto the ground at the same time. This will help keep the load even through your pelvis. Then you want to slowly wiggle towards the edge of the seat, which will allow you to place your feet out slightly wider to make room for your growing belly. You will then bend at the hips and stand up nice and tall. Getting back into the car is just the reverse of this movement. So the first thing you want to do is turn around and place your bottom first into the seat. Keep your legs glued as you swing them back into the car. So lifting is another movement that pregnant women love to adapt, and what they tend to do is hinge forward at the hips, which basically places all the weight of the baby on the abdominal wall, creating a lot of tension. So what you want to do is get as close as possible to the object, bend your knees, squat down, keeping a nice neutral spine, place the object as close to your body as possible, and then perform a nice exhale breath as you stand back up. This will just help engage the pelvic floor and your core muscles so that you're hugging your belly towards your spine, protecting your spine and your pelvis. Good posture in standing and sitting will reduce the amount of load going through the abdominal wall. Muscles have a sweet spot, and that means that they contract and work better when they are in an optimal length tension relationship. This means that your pelvic floor muscles and your deep core muscles will be able to contract and reduce the load going through your abdominal wall. Let's go through your sitting posture. So typically what we see in sitting is either people are sitting right on their sit bones and arching into the lower back, or they slump into the lower back and roll off the sit bones. This creates a lot of load through the abdominal wall as it makes it very hard for the pelvic floor and your core muscles to activate. What you need to do is sit back in the chair, and this may mean that you need a rolled up towel to support the curve in your lower back. Make sure that your knee and your hip are equal, making a 90-degree angle, and it may mean that you need to put something under your feet. Make sure that you lengthen and grow tall through the crown of your head. In standing, what we see is the pelvis tilts anteriorly, which means that we have an increased curve in the lower back. And this is due to the weight of the baby, which shifts our center of gravity forward. To find that neutral spine position, all you need to do is gently rock the pelvis backwards and forwards. You feel these two extreme movements and you stop in the middle. So I'm not saying to tuck your tailbone under that you feel that you're just gripping with your glute muscles. You just want to find that nice neutral position that makes you feel lifted through your spine and you grow taller through the crown of your head. You will see a slight lift up and in of the tummy, and that just lets you know that your pelvic core and your deep abdominal muscles are working nicely and in a coordinated fashion. Keeping your core strong through pregnancy helps aid in the delivery process as well as your recovery in your postpartum journey. So if you want a full body workout that is safe to do through every trimester of pregnancy, make sure you watch this video next.